Hello everyone, my name is Alex Legenhausen. For this semester, I decided to write my research paper about the disparity in healthcare for different ethnic groups. Before we talk about the healthcare disparities, we need to understand some context though. African Americans and Hispanic Americans work low quality, low wage jobs at higher rates compared to white Americans. One study defined high quality jobs as jobs that made more than $38,000 a year, had healthcare benefits, and offered a retirement plan. They found that 26.4% of Americans had what they would count as low quality jobs, so jobs that did not have those requirements, and 25% of Latinos worked low wage jobs. They found that Hispanic immigrants specifically worked 41% of extremely low quality jobs, which were usually manual labor, and they paid as low as 50% of the poverty line. One reason that there's this large disparity in job quality is because of access to higher education. Especially Hispanic immigrants struggle to receive higher education since their education they received in their countries did not carry over to the United States. One study found that 37% of white Americans had a four-year college degree, while just 23% of African Americans had a four-year college degree, and 16.4% of Hispanic Americans had a four-year college degree. So, since minorities usually don't work as many quality jobs with health insurance benefits, they tend to be uninsured at higher rates. A study found that in America, 14.5% of adults don't have health insurance. When broken down to people of different ethnic groups, they found that white Americans were uninsured at a rate about 10.2%. African Americans were uninsured at 14.3%, and Hispanic Americans were uninsured at a high rate of 30.2% of them. So this shows that minorities are much more likely to lack health insurance. Access to healthcare is very important for people's long-term health. In the short term, they can fix temporary ailments that people deal with, such as body pains, the flu, etc. However, it's much more important for long-term health. People need preventative care so they can get tests and help get serious ailments under control before they get too bad. If people don't get these preventative healthcare checks, they can suffer from illnesses that could have been prevented and that will lead to major problems down the road, such as heart disease and cancer. When they finally do go to the doctor, their conditions are usually so bad that they require major procedures, such as amputation and orchiectomy. Both surgeries happen to minorities at comparatively much higher rates compared to white Americans. They also found that since minorities usually try to avoid going to the doctor, when they do go, if they suffer from certain illnesses, then they're more likely to die because they catch them too late. They specifically found this with breast cancer in minority women. So even people who do have health insurance still suffer from disparities. This is because people with low quality jobs, even if they do get health care, it's usually lower quality. They still might have to pay hundreds of dollars a month to get this quality of health care, and they may be required to pay what's called co-payments, which are additional fees every time they see the doctor. Due to the high cost of insurance and co-payments, people with low quality insurance usually don't want to go to the doctor since they can't comfortably afford it. These co-payments especially affect minorities. One study found that minorities are 40% less likely to receive specialist care because of the high cost of co-payments. In that study, they found that many of the people who avoided seeing the specialist for their conditions ended up having to revisit the doctor at much higher rates because they didn't get their conditions checked before it got too late. So even when they do go see the doctor, they usually don't have the same quality of healthcare. So they are less likely to get offered some medical procedures like cancer screenings, vaccines, and specialist consultations. They also get treated differently compared to white Americans, even though if they suffer similar conditions. So they tend to get offered less kidney and bone marrow transplants, get lung cancer tests when they exhibit the similar symptoms, and they're less likely to get admitted to the hospital for chest pain, which is the sign of a heart attack about to happen. They also found that minorities tended to have to wait to get admitted to the hospital for longer times. One reason that people of color don't get offered as many health services is because the doctors tell them that they would have to pay an extra co-payments and they want to avoid it. So they just risk it and try to not get as many services as possible. Another factor, specifically for Hispanic immigrants, is that they usually don't speak English as their primary language. This makes it much harder for them to communicate with their doctor, so their doctors tend to underestimate the severity of conditions and don't appropriately treat them. I believe that many of these problems can be fixed by expanding Medicare in America, so it provides coverage for everyone and not just the elderly. We see similar systems like this in other developed countries in the Western world, such as Canada and the United Kingdom. With this, everyone will have the access to the same services and won't be deterred by co-payments. This will also save America more money because we remove the private industry's profit margins, which will end up reducing the cost and bringing down the cost of all medical services and supplies. I believe we should move to this system as a moral obligation to help as many people as possible end ethnic differences and disparities in healthcare, and it just makes financial sense. Thank you for listening. I hope you all have a nice day.